Are you ready to dive into the terrifying world of deadly diseases? If so, then stick around because today we're going to tell you about 20 scary facts about actinomycosis. Before we get started, be sure to like and subscribe for more videos like this one. Also, be sure to stay tuned until the end for some really scary facts. Let's go. Number 20. What is actinomycosis? Actinomycosis is a rare but serious bacterial infection that can affect the brain, spine, and other parts of the body. It is caused by a bacterium called Actinomyces israelii, which is part of the normal flora of the human body. This means that the bacteria are usually present in the body without causing any harm. However, under certain circumstances, the bacteria can become pathogenic and cause disease. The infection typically occurs in people who have a weakened immune system or who have had recent surgery. Symptoms of actinomycosis include fever, chills, headache, nausea, vomiting, and a stiff neck. Treatment of the infection usually involves a combination of antibiotics and anti-inflammatory medications. Number 19. Where did actinomycosis come from? Actinomycosis is an ancient disease that has been around for centuries. In fact, it was first described by the Greek physician Hippocrates in the 5th century BC. He named it after the root word actinos, which means ray. This is because the bacteria that causes the disease forms these long, thin filaments that look like rays of light. Despite its ancient origins, actinomycosis is still relatively rare today. In fact, only about 1 to 2 cases are reported per million people each year. However, the disease can be particularly dangerous in developing countries where access to healthcare is limited. There is no known cure for actinomycosis, but early diagnosis and treatment can prevent complications. With prompt medical attention, most people who contract the disease make a full recovery. Number 18. Who is at risk for actinomycosis? While anyone can get actinomycosis, certain people are at higher risk of developing the disease. These include people with weakened immune systems, such as those with HIV/AIDS or who are taking immunosuppressant drugs, as well as people who have had recent surgery or dental work. People who live in areas where the bacteria that causes actinomycosis is more common, such as the southern United States and Latin America, are also at increased risk. Finally, people who work in healthcare settings or who take care of sick people are at higher risk of exposure to the bacteria. Number 17. How does actinomycosis spread? Actinomyces israelii is a bacteria that can be found in soil and dust. It is also present in the gastrointestinal tract of many animals, including humans. The bacteria can enter the body through breaks in the skin or through the respiratory tract. It can also be transmitted through contaminated food or water. Once inside the body, the bacteria can spread to other parts of the body through the bloodstream or lymphatic system. The bacteria typically affects the brain and spine, but it can also affect other parts of the body, such as the lungs, skin, and pelvic bones. Number 16. How many people have actinomycosis? According to the World Health Organization, WHO, actinomycosis is a rare disease that affects about 1 to 2 people per million each year. The disease is most common in the southern United States and Latin America, where it affects about 6 to 7 people per million each year. Number 15. What are the symptoms of actinomycosis? Actinomycosis can cause a variety of symptoms, including fever, chills, headache, nausea, vomiting, and a stiff neck. The symptoms of the disease can vary depending on the location and severity of the infection. For example, actinomycosis of the brain can cause seizures, while actinomycosis of the spine can cause pain and paralysis. In severe cases, actinomycosis can be fatal. Number 14. Is there a vaccine for actinomycosis? At this time, there is no vaccine available for actinomycosis. However, researchers are working on developing a vaccine to prevent the disease. In the meantime, people who are at high risk of contracting actinomycosis may be able to take antibiotics prophylactically. This means that they can take antibiotics regularly to prevent the bacteria from taking hold and causing disease. Number 13. Can you catch actinomycosis from someone else? No, you cannot catch actinomycosis from someone else. It is a rare disease that is not contagious. The bacteria that causes the disease is only found in soil and dust, as well as in the gastrointestinal tract of animals. so it is not possible to catch it from a person who has the disease. However, it is possible to get the disease from animals. This is why people who work in animal care facilities are at increased risk of contracting actinomycosis. Number 12. How do you diagnose actinomycosis? Diagnosing actinomycosis can be difficult because the symptoms of the disease are not specific to this condition. In addition, the bacteria that causes actinomycosis is very slow-growing, which means that cultures of the bacteria may not be positive for several weeks. This is why it is important to seek medical attention right away if you develop symptoms of actinomycosis. A doctor will ask about your symptoms and medical history and perform a physical exam. They may also order blood tests, imaging studies, such as a CT scan or MRI, or a lumbar puncture to diagnose actinomycosis. Number 11. How do you treat actinomycosis? Actinomycosis is treated with a combination of antibiotics and anti-inflammatory medications. The type and duration of antibiotics will depend on the severity of the infection and the location of the infection. In general, it is recommended that people with actinomycosis take antibiotics for at least 2 weeks after the symptoms have disappeared. Anti-inflammatory medications can help reduce inflammation and pain associated with actinomycosis. In some cases, surgery may be necessary to remove any affected tissue. Number 10. Can you prevent actinomycosis? There are a few things that you can do to help prevent actinomycosis. First, avoid contact with soil and dust, especially if you are in an area where actinomycosis is common. Second, practice good personal hygiene, such as washing your hands thoroughly after being in contact with animals. Third, if you are at high risk of contracting actinomycosis, talk to your doctor about taking prophylactic antibiotics. Taking antibiotics regularly can help prevent the bacteria from taking hold and causing disease. Number 9. What is the prognosis for actinomycosis? The prognosis for actinomycosis is generally good, especially when the disease is diagnosed and treated early. With prompt medical attention, most people who contract the disease make a full recovery. However, in some cases, the disease can be more severe and may lead to complications such as meningitis, brain abscess, or spinal cord compression. These complications can result in permanent disability or even death. Number 8. What is the mortality rate for actinomycosis? The mortality rate for actinomycosis is about 5%. This means that out of every 100 people who develop the disease, about 5 people will die from it. The mortality rate can vary depending on a number of factors, including the severity of the infection and the location of the infection. In general, actinomycosis of the brain is more severe than actinomycosis of the spine, and actinomycosis that spreads to other parts of the body, such as the lungs or skin, is also more severe. Number 7. What are some of the misconceptions about actinomycosis? There are a number of misconceptions about actinomycosis. Some people believe that the disease is contagious, when in fact it is not. Others believe that the disease can be spread through casual contact, such as hugging or shaking hands with someone who has the disease. This is also not true. In addition, some people believe that actinomycosis is always fatal, when in fact the mortality rate is only about 5%. Number 6. What is the life cycle of the bacteria that causes actinomycosis? The bacteria that causes actinomycosis, Actinomyces israelii, is a gram-positive filamentous bacterium. It is part of the normal flora of the human body and is found in the gastrointestinal tract of about 70% of people. The bacteria can be transmitted to humans and animals through contaminated food or water, or through contact with soil or dust. Once inside the body, the bacteria can spread to other parts of the body through the bloodstream or lymphatic system. The bacteria typically affects the brain and spine, but it can also affect other parts of the body, such as the lungs, skin, and pelvic bones. Number 5. How does the bacteria that causes actinomycosis evade the immune system? The bacteria that causes actinomycosis has several mechanisms that it uses to evade the immune system. One of these mechanisms is the formation of biofilms. Biofilms are complex communities of bacteria that are encased in a protective matrix. This matrix makes it difficult for the immune system to reach the bacteria and kill it. In addition, the bacteria produces a number of enzymes that help it to evade the immune system. One of these enzymes is a protease, which breaks down proteins and antibodies. Another enzyme is an IgA protease, which specifically targets and breaks down immunoglobulin A, an antibody that is important for protecting against bacterial infections. Number 4. Why is actinomycosis more common in some parts of the world than others? Actinomycosis is more common in some parts of the world than others because the bacteria that causes the disease is more common in those areas. In addition, the disease is more common in developing countries where access to healthcare is limited. This means that people who live in these areas are more likely to be exposed to the bacteria and are less likely to receive treatment for the disease. Number 3. Is actinomycosis a reportable disease? Yes, actinomycosis is a reportable disease in some countries. This means that cases of the disease must be reported to the local health authority so that they can be investigated and treated. In the United States, for example, actinomycosis is a nationally notifiable disease, which means that it must be reported to the Centers for Disease Control and Prevention, CDC. Number 2. Did someone famous ever have actinomycosis? There is no record of any famous person having actinomycosis. In fact, the disease is so rare that it is unlikely that any famous person has ever had it. Number 1. What is the scariest fact about actinomycosis? The scariest fact about actinomycosis is that the bacteria that causes the disease is part of the normal flora of the human body. This means that the bacteria is present in the body without causing any harm. However, under certain circumstances, the bacteria can become pathogenic and cause disease. This makes it difficult to diagnose actinomycosis early because the symptoms of the disease are not specific to this condition. In addition, the bacteria is very slow growing, which means that cultures of the bacteria may not be positive for several weeks. Well, there you have it, 20 scary facts about actinomycosis. Do you know anything else about this disease? Let us know in the comments below. Be sure to like and subscribe for more videos like this one. Thanks for watching.